I work in 3 different places in the hospital. I work here certain days, I work in the emergency, and then I work upstairs at the rapid access clinic. It is the elephant in the room for a lot of people, but for me, honestly, it's just the way that I am, and it doesn't really come to mind a lot of times, a little bit more when people point it out, but for me, it just feels natural to be like this.
Working as a doctor in a busy ER during a pandemic is challenging enough. Imagine doing so with only one hand. I will introduce you to Dr. Vanessa Knight, an ER physician at the Lakeshore General Hospital in Montreal's West Island.
I grew up in the West Island, so I kind of wanted to work in my community, give back. And I wear a prosthetic, especially when I'm working, to help me adapt to certain procedures that I would normally have to do with 2 hands, but for me, I just use my prosthetic arm instead.
Dr. Knight was born without her left hand. She's never let it get her down, using it instead to help inspire others, and has worked with War Am since she was a baby.
Now I've actually become a little bit more of a mentor for amputees that are going into the healthcare field. So I'm mentoring some nurses, some doctors, and I'm basically telling them the same thing. Like, don't be afraid to tell people like when you need help and what you can do, because you are ultimately the person that knows that.
She's no stranger to the challenges healthcare workers have faced amid the ongoing pandemic.
During the pandemic, we have a lot of people that are losing trust in the healthcare system, and being as someone who's a representative of the healthcare system, I find it difficult to kind of help reinstate that trust. In terms of my disability, most people have been really trusting, and actually it makes me a little bit more approachable as a physician, because they can kind of relate that they're patients with their own struggles, and I've had my own struggles, and it helps me connect to them a little bit more on that level.
Connecting more is something Dr. Knight sees as so important, and she's hoping young people who may be struggling with their own disabilities see that there's always a way.
There's always going to be people that doubt you, but you are the one who knows yourself the most. You are the one who knows your own ability, and you have to be able to show them what you can do, because no one can tell you what you can do. You're the one that has to lead the way in that respect. And I would also tell them that there are a lot of people that are on your side, and use those people to your advantage. Really build up the group around you.
In Montreal, Fariha Naqvi-Mohamed, City News.